Welcome to Kitchen Table Talks. I'm your host, Stephanie Seaton. The purpose of these table talks is to have an informal chat with those who have shaped the field of bioethics and to provide information about educational opportunities for those who, like me, are interested in learning more. This is episode 1, an introduction to Wake Forest University's bioethics program, featuring a discussion with Nancy King and Vicki Zickmund. This is brought to you by Wake Forest University's Bioethics Graduate Program. We're so glad you're here. Please pull up a chair and join us. On Kitchen Table Talks today, I'm interviewing Vicki Zickmund and Nancy King. Thank you for joining me. Vicki, you're the Associate Director of the Graduate Program in Bioethics. Nancy, you're the Co-Director of the Center for Bioethics, Health and Society, the Co-Director of the Graduate Program in Bioethics, and a Professor in the Department of Social Sciences and Health Policy and the Wake Forest Institute for Regenerative Medicine. Thank you for joining me today. First, would you tell us a bit about yourself? Vicki, why don't you go ahead first?
Sure. As Stephanie mentioned, my name is Vicki Zickmund. I am originally from upstate New York, and I always like to clarify, I'm specifically from northeastern New York. I did my undergraduate work at Syracuse University and my graduate work at the University of Florida. I've been in this position for 12 years. And prior to that, I was, for about 20 years, I worked in strategic planning and business planning in healthcare systems, worked both clinical and in academic missions.
Great, thank you. Nancy?
Well, I'm even older than Vicki. I have a law degree. I actually studied law because I thought it was a really great way to get into bioethics. And I learned about bioethics when I was an undergraduate. I went to St. John's College, which is a great book school where you spend 4 years learning how to talk about really important and interesting issues. And at that time, one of my professors told me about the beginnings of the Hastings Center and the Hastings Center report. So I started reading the earliest issues of the Hastings Center report as an undergraduate. Then after law school, I spent 20 years on the faculty of the UNC School of Medicine in Chapel Hill, where I taught bioethics issues to medical students, and came here to Wake Forest almost 14 years ago now, specifically so that I could help to start our graduate program in order to teach bioethics to people who really wanted to be able to use it in their scholarship, teaching, and practice.
Wonderful, thank you. Nancy, what would you say bioethics is?
That's a really interesting and challenging question because it doesn't fit in an elevator pitch. Bioethics is really a field of scholarly and practical inquiry focusing on the ethical, societal, and policy issues that arise from health and illness, from healthcare and public health, and from health-related research. And what that essentially means is that people who do bioethics come from a wide variety of disciplines and professions, all of which feed into the questions, issues, and problems that arise in the field. So I mentioned that I studied law because I thought it was a good way into bioethics, and all of the healthcare professions also fit into bioethics, as does business, public health, religion, the healthcare humanities, the medical humanities, and social sciences like anthropology, even literature and medicine, medical sociology, and a wide range of additional disciplines like epidemiology, social work, just about anything that gives rise to an interest in and a need to think about the ethical issues that arise from healthcare, and research.
Wonderful, thank you. So Nancy started to touch on who maybe should study bioethics. Vicki, would you like to add to that?
I think it's something that if you're interested in that intersection between healthcare, the broadest definition of healthcare you could possibly think of, and really exploring, quote unquote, what is the right thing to do. Whether, as Nancy mentioned, whether that's from a clinical perspective, from a research perspective, or a policy or public health perspective. I think, we as humans, we deal with bioethical issues almost, I don't want to say daily, but certainly on a weekly basis, and feels daily currently, I think. And so we bring ourselves to this field, and for those who are really interested in pursuing that professionally, I think you bring that, not only your personal experience, but your academic credentials and background. So as Nancy mentioned, it's really a broad interdisciplinary field. We've had some great students who've come from even the arts. And we have a student who came from dance. We've had students who've come from religion and divinity. So it's really quite broad. It's much broader than I think the typical person might believe, that it's only clinically oriented or research oriented.
Thank you. And what degree options are available at Wake Forest University, Vicki?
We actually offer a Master of Arts in Bioethics, which is both in a full-time and a part-time basis. And we offer 3 graduate certificate options. Again, both can be pursued on a full-time or a part-time basis. The difference between the two is the graduate certificate options do not require a thesis, and there's about half the amount of coursework that's required. It's a great way to strengthen an individual's, dare I say, didactic exposure to the field, particularly for our working professional students who just want something to add to their toolbox or to their basket of tools that they've put together over their professional careers. But certainly our working professional students also can pursue the master's as well. In addition to our Masters of Arts program and our graduate certificate programs, we do have some dual degree options as well as a 5-year program for our Wake Forest University undergraduates. The dual degree programs are with the School of Medicine, the School of Law, and the Divinity. And so students are able to pursue both of those areas in an interdisciplinary, intersectional sort of way, so that they can move forward in their careers, bringing those different fields with them. The dual degree, or the 5-year option for our Wake Forest undergraduates, we may do a separate table talk on that particular option, but on a high level, this is an opportunity for Wake Forest University undergrads to begin their academic career in our program before they finish their bachelor's degree. And we have had a number of students pursue that as well.
Great, thank you. What do your graduates go on to do? Vicki, we'll continue with you.
Sure. So our students have, again, because it's such an interdisciplinary field, we have students who bring different interests to our program and then leave sometimes in the same area, but often in different areas. We have alumni who get involved with clinical trials, with institutional review boards, who teach in various in a School of Medicine. We have an alum who's also a clinical ethicist at our local medical center here. So it is really quite broad in terms of what our students can pursue, because they can really pursue that passion that they're looking for.
Great, thank you. Nancy, any students that you might have in mind?
Well, yeah, I mean, it's really heartening how many areas students move into to augment things they're already doing or planning to do. So we have many students who go on to practice law or practice medicine with a focus on bioethics. We have students, we have one student who is a very senior clinician moving toward retirement, who after he got his degree, he went on to become chair of the ethics committee at the institution where he still does a little bit of practicing. We have students who have moved from one area in which they were previously practicing to something else. For instance, we had a minister who moved more deeply into some community work she'd been doing. And although while she was a student said she wasn't really interested in clinical ethics, has now become a member of a clinical ethics committee. So we have a student who was getting her degree in social work. At the same time, she was getting a master's with us, and she went on to become a patient advocate in the hospital setting to augment the work of ethics committees and ethics consultation by being able to take a great deal of focused time with patients and families having a particular broad set of challenges. I'm trying to think of some others. I know that there are, well, the student who came from dance that Vicki mentioned has become both an ethics consultant and a teacher in the medical school where she consults, and has actually been one of the pioneers, and we have several in our graduates who are pioneers in creating crisis standards of care for their institutions as a result of the COVID-19 pandemic. So there are many, many ways in which our students go on to really make use of bioethics in whatever they pursue.
That's wonderful.
Yeah, can I just add, we've had students who've also pursued, I mean, Nancy mentioned going on to law school and medical school, but we've also had students who pursued an academic career in their getting a PhD or something similar, exploring the intersection between writing and ethics and narrative medicine. Mm-hmm. And I think sometimes in bioethics, we think of the obvious things of clinical and research and policy, which is of course excellent and most important, but we do have some alum who pursue and are pursuing academic careers in all of those different areas that Nancy mentioned earlier.
Wonderful. Anything else you wanted to add, Nancy? It looks like you were going to say something.
Well, I was also thinking that the policy work comes up in so many different ways. For instance, we have one graduate who makes really important use of her bioethics education as a member of a local school board. And has really faced a number of bioethics issues in the current decisions about whether to bring elementary school students back into the classroom or pursue online options, and has come up with some very creative solutions that can be pursued. So the thing about bioethics is that it can be useful in so many different ways.
That is true. As a student myself, I'm learning that quite a bit. Great, thank you. For those that are interested in learning with us here at Wake Forest, how should they get in contact? Vicki?
Absolutely, they can contact us. They can certainly email me directly at zickmuvl@wfu.edu, or they can look at our website. Yeah, so as you can see, this is my email address as well as our website, and we encourage you to explore our website, and if there's a contact us place as well that you can put your information, and I will follow up with you directly.
Great. Well, thank you both for joining me in Kitchen Table Talks today.
Thank you, Stephanie.